You need natural blood flow to the penis to have and maintain an erection. Natural methods to increase blood flow to the penis include exercising, managing stress, and cutting back on alcohol. During an erection, arteries expand and muscle contractions move blood into spongy tissues to make the penis erect. Without enough blood flow, you may develop erectile dysfunction, ED. ED can make it hard to perform sexually and affect your self-esteem and intimate relationships. What? Do aerobic exercises. Adding more aerobic exercise, cardiovascular exercise, or cardio to your routine can increase blood flow to the penis by improving blood pressure and circulation. These exercises rhythmically work large muscle groups to increase heart rate and oxygen intake. Exercise can support testosterone production, which can improve ED. One review found that 40 minutes of moderate to vigorous aerobic exercise 4 times a week helped improve ED in men. Types of aerobic exercise that may help improve blood flow to the penis include cycling, dancing, hiking, running, spinning, step aerobics, swimming. Talk to a healthcare provider before starting a new exercise routine, especially if you have any underlying conditions. 2. Strengthen your pelvic floor. Training the pelvic floor muscles or muscles that support the bladder and bowel may improve blood flow to the penis. These muscles include the ischiocavernosus and bulbospongiosus, which contract to move blood into the penis and make it erect. Limited research has shown that pelvic floor exercises can improve erectile function in those with ED. One study found pelvic floor muscle training improved erectile function after prostate surgery. Try Kegels. Here is how to perform a type of pelvic floor exercise known as Kegels. Make sure your bladder is empty. Start standing, lying down, or sitting in a chair. Tighten your pelvic floor muscles like you are holding in P. Hold for 10 seconds. Make sure you are not contracting your glutes, thighs, or abdominals. Relax the muscles for another 10 seconds. Repeat 5 times a day. Make sure you do not overdo the number of repetitions and how often you do Kegels. Over-exercising the pelvic floor can cause muscle fatigue and increase urinary incontinence or leaking urine. 3. Eat a nutritious diet. Eating a balanced diet helps maintain erectile function and improves blood flow to the penis. A nutritious diet, combined with exercise, can support testosterone production to improve erectile function. A study of more than 21,000 men found that those who followed a Mediterranean or Alternative Healthy Eating Index 2010 diet were less likely to develop ED. Both diets recommend avoiding red and processed meats. Foods included in the Mediterranean diet include dairy, meat, and eggs in moderation, fruits like apples, berries, citrus fruits, grains like millet, barley, farro, buckwheat, legumes like lentils, chickpeas, white beans, nuts and seeds like almonds, pumpkin seeds, pistachios, walnuts, olive oil, poultry, seafood like fish, mussels, shrimp, vegetables like leafy greens, zucchini, squash, asparagus. 4. Manage stress. Prolonged periods of stress or anxiety increase levels of the stress hormone cortisol, which may lower testosterone levels and increase the risk of ED. Elevated cortisol can also increase blood pressure, slow blood flow, and narrow or damage blood vessels. Ways to help manage stressors include acupuncture. Limited research has shown that acupuncture may reduce stress, improve blood flow, and enhance erectile function. It uses thin needles to improve energy flow, or qi, pronounced chi. Breathing exercises. Diaphragmatic breathing may improve erectile function. It involves deep inhaling and exhaling through the lips. Meditation. Meditation can manage stress, improve blood flow, and sexual performance. Mindful meditation may also help with sexual performance anxiety. Yoga. Yoga can reduce stress and anxiety and may improve erectile function. 5. Avoid smoking. Avoiding smoking may improve blood flow to your penis and erectile function. Smoking alters the blood vessel's lining and lowers nitric oxide production, which prevents the muscles in the penis from relaxing and allowing blood flow. Smoking may also increase your risk of ED because it damages your circulatory system, which carries blood through the body and to the penis. E-cigarettes can also contribute to ED, but may have a less severe effect. It can be challenging to avoid smoking for good, but some treatments can help. Ask a healthcare provider about medications and counseling that can help you. 6. Limit alcohol. Cutting back on alcohol may increase blood flow to the penis. Drinking too much interferes with brain chemicals that help the penis fill with blood when aroused. A study found that participants with alcohol use disorder improved erectile function after a month alcohol-free. Another study found that 88% of participants had improved erectile function after 3 months of no drinking. Drinking in moderation is considered up to 2 drinks a day for men. Reach out to a healthcare provider and a trusted family member or friend if you think you may be dependent on alcohol. 7. Take supplements. Some herbal and dietary supplements show promising results as an alternative remedy to increase blood flow to the penis. No herbal supplements have been proven to treat ED effectively and safely. Supplements like L-arginine, ginkgo biloba, and yohimbe may improve vasodilation, which opens blood vessels and increases blood flow. L-arginine and ginseng can also improve blood flow and relax the muscles needed for an erection. Before taking any supplements, talk with a healthcare provider to make sure they will not interact with medications or worsen any conditions. Ginkgo biloba can increase bleeding and is unsafe if you have a bleeding disorder or take blood thinners. How to treat erectile dysfunction. A healthcare provider may recommend treatment if natural remedies do not increase blood flow to the penis. Treatment for ED may include oral medications, phosphodiesterase, PDE. Inhibitors help relax smooth muscle in the penis to increase blood flow and keep the penis erect during arousal. Injectable medications. Injectable medications called Muse, alprostadilkin, improve blood flow to the penis. It is inserted directly into the penis or as a suppository into the urethra. Surgery. Severe erectile dysfunction that does not respond to medication may require surgery. It is a last resort medical treatment for ED, as it has a higher risk of infection. Therapy. A licensed therapist can help relieve and overcome stress that affects your sexual performance. Cognitive behavioral therapy, CBT, is a form of therapy that helps you reframe negative, stressful thoughts and feelings. When to seek care. See a healthcare provider if you consistently have difficulty forming or maintaining erections. They can help you determine the cause and find treatment to improve your quality of life. Medications like antidepressants, blood pressure drugs, and sedatives can cause ED. It can also be a sign of an underlying condition, such as anxiety, including fear of intimacy and sexual performance anxiety, atherosclerosis, or arteries that become narrow due to plaque buildup, chronic kidney disease, depression, diabetic neuropathy, or nerve damage from diabetes, heart disease, high blood pressure, penis, spinal cord, prostate, bladder, or pelvic injury. A healthcare provider will likely refer you to a urologist who specializes in the urinary tract system. They will ask about your health history, perform a physical exam, and order blood tests to diagnose ED. A quick review. Using natural methods to increase blood flow to the penis can improve erections. Eating a balanced diet, exercising, and managing stress may improve blood flow to the penis. Avoiding smoking and limiting alcohol may also help. Please like, comment, subscribe, and share.